Hi, good afternoon. My name is Anthony and I'm from the Respiratory Care Department. Before I will start, can I ask for your complete full name and date of birth, please? Okay, very good. I'll just sanitize my hands. Would you mind if I'm going to go beside you as I will assess you first and check for your vital signs? Can you lean a little bit forward, please, and do deep breathing? Okay, continue. Very good. Okay. Very good. Okay. Okay, very good. So I'm going to listen also in front. Okay. Right. Very good. Okay. So I'm going to check your heart rate, and then I have here a portable pulse oximetry. Check for your level of saturation. So I think we're done taking up your heart rate and also your level of saturation. I'm going to sanitize again my hands. So the reason why I'm here is because the doctor ordered a breathing treatment. So there will be 3 different breathing treatments that I'm going to administer. So the first breathing treatment that the order doctor was albuterol. So it has a frequency of every 4 hours, and then it will be given through a small volume nebulization. So this one here is my equipment and also the nebulizer. So I'm going to using a compressor-based nebulizer. So inside is the medication, which is the albuterol. So what we're going to do is put this one inside your mouth with your lips sealed, and also don't forget that your tongue should be below. Do not obstruct it inside. Okay? And then once it's inside your mouth, you have to do a normal breathing. Just relax. And also do occasional deep breathing. So another thing is that the reason why we're given is because as we have seen in your chart, there was some infiltrates in your x-ray, and also as I was listening to your lungs, there was also some secretions. So it would help mobilize your secretions in order for you to breathe more comfortably. Okay, so shall we start? So put this one inside your mouth with your lips sealed, and then do normal breathing with occasional deep breaths. Okay. Okay. So I think we're done taking up this nebulization. So I will just let you rest for a minute for the effect of the medication while I'm preparing for the next breathing treatment. So I think we're done waiting for at least a minute. So the next medication that I will administer is through an inhaler, which is a dry powder inhaler. The medication that I will give is for Moterol, and its name is Brovana. And then the medication, it comes with a timing of twice a day. So this one here is the dry powder inhaler. So all you have to do is, I'm going to demonstrate it, is going to twist this until you hear a click sound, and that means it is ready for use. That. And then prior to putting inside your mouth is you have to exhale all your air out away from the device. And then once you're ready, put this one inside your mouth. Once you put this one inside your mouth, it should be sealed and tight with your lips, with your tongue below. And then once you're going to start inhale, you should do a deep inhalation. And then once you inhale the medication, hold your breath for at least 10 seconds or as much as you can. Okay? So we're going to start. So I'm going to twist this one for you. Okay. And then exhale all your air out away from the device. Okay, very good. So put this one inside your mouth. And then I'm going to count 1, 2, 3 to do a deep inhalation. 1, 2, 3. Hold your breath. Okay, hold your breath. And good. Remove and exhale normally. Very good. So I'm going to let you rest again for at least a minute for the effect of the medication, and then I'm going to prepare and ready for the next breathing treatment. So, since we're done letting you wait or rest for at least a minute, so the last medication is through inhaler also, but this one is a meter dose inhaler, which is similar to the previous one, but it comes with a liquid dose, as the previous one comes from a powder form of medication. So the medication that I will administer is a corticosteroid. So this one name is Advair, with 2 inhalations for at least twice a day. So this one here in front of you is the meter dose inhaler. So you're going to position your hand with your index finger on top and your thumb underneath or below for support. So you're going to shake the device for at least few seconds and then prime the dose away from you just once, or actually press, and then after that you exhale your air out until you feel your lungs are empty. Okay, so we're going to do it now, and then after that, by the way, is you have to put this one inside your mouth with your lips sealed, and then once you put this one inside your mouth, I'm going to guide you also first so that you will be aware how to do this, and then I'm going to count 1, 2, 3 before inhalation. Okay, so I'm going to shake the device, actuate this once or prime the dose, and then exhale all your air out. So we're ready to go. Put this one inside your mouth, lips sealed, and then I'm going to count 1, 2, 3. Okay, 1, 2, 3. Inhale. Hold your breath for at least 10 seconds. Hold your breath, and then move the device and exhale normally. Okay. So by the way, this medication comes with a corticosteroid. So for you to prevent some side effects such as the oral thrush, we're going to give you a glass of water. So all you have to do is you have to rinse it. Do not swallow the water. All you have to do is gargle inside, rinse your mouth, and spit it out. So here's the glass of water. Okay, gargle and spit it out. Okay. So another thing to note for you is in order for you to be educated, is the rinsing of the device. So especially for a small volume nebulizer, you should rinse the nebulizer kit and disassemble them one by one and rinse them with sterile water. Do not rinse it with a tap of water, because it might contaminate. And do not include in rinsing the Tygon tubing or the tubing of the nebulizer kit. And then after you're rinsing it, you leave it on the side and let it air dry. And then another thing is for the inhalers, it should be stored in room temperature, and also the meter dose inhaler, it should be stored upright. And then, is there anything else I can do for you? Okay, very good. So prior to assessing you, can you inhale deep and cough for me? Okay, so I will just listen for your breath sounds and check your vital signs. Continue now breathing. Very good. So I'm going to check your vital signs, checking your heart rate, respiratory rate, and I'm going to touch here portable pulse oximetry for your level of saturation. So I think we're done taking up your vital signs. Going to have adjust your side rails first to make you more comfortable. And also, by the way, this is a call light. It's already on your bedside. So all you have to do is just press this one, the red button, in case if you need assistance, and if you need some to do re-instructions again on how to do the breathing treatment, so that we can respond to you as soon as possible. And I'll just adjust the temperature for you. And here another thing is I'm going to give you a glass of water at the bedside, so that if in case you're thirsty. And then rinse your hands. So thank you so much for your day, and thank you so much for your cooperation. Have a good day.